This is Pat Walter for the Surface Hippie website, and today I'm interviewing Dr. Rector from Boulder, Colorado. We're in Camelback, at the Camelback Resort in beautiful Arizona. Hi, Dr. Rector.
Good morning.
What device do you usually use when you do hip resurfacing?
I have consistently been using the Birmingham hip resurfacing technique and prosthesis.
And when and where did you train to do resurfacing?
I did my training in June of 2006 in Calgary, Canada.
And about how many have you done to date?
I've done just over 500 hip resurfacing procedures.
Good. When a patient comes to you, who would you tell them are the best candidates for resurfacing?
I think the best candidates for resurfacing are men under 60 to 62 years old and women under the age of about 50 to 55. I also want patients with good quality bone, as well as healthy, active patients who will be able to use some of the benefits of resurfacing.
And what are the advantages of resurfacing versus a total hip replacement?
I think there are 3 or 4 major advantages. The biggest advantage is the preservation of more bone in the upper part of the femur, which becomes a significant advantage if revision surgery is necessary in the future. Definitely hip resurfacing has a lower dislocation rate than conventional total hip replacement. And finally, there is an absence of thigh pain with hip resurfacing compared to conventional total hip replacement.
Is that from the structure of the device or the way the surgery is done? Or
there is thigh pain in a conventional total hip replacement related to the stress of the femoral stem on the bone in the upper femur.
Do you feel high metal ions are a problem with resurfacing?
At the current time, I think high metal ions are a concern, but I don't recognize them as being a significant problem, particularly with the Birmingham prosthesis.
If you suspected or a patient had high metal ions, how do you test for that?
It's very hard to test for a metal ion sensitivity issue. I think it's pretty clear that conventional skin testing for metal allergy is not accurate, and I believe there is a fairly sophisticated test that can be done by sending blood to Chicago for a special test for metal sensitivity.
There has been a lot of negative press against resurfacing. Just generalities. It's not for women, it's not for older men, on and on. Could you address that, and who is it really for? And this information is really wrong if anybody knows about the Birmingham hip resurfacing device and outcomes.
Well, as I said, there is a concern about metal ions. Women seem to be a little more sensitive to the metal issue than men do. But I still feel that in properly selected patients, the advantages of resurfacing outweigh the small disadvantage of the risk of metal ion issues.
If I were a prospective patient, what would you tell me about possible revisions in the future, infection rates, metal allergies that we haven't covered?
Well, I advise patients that the metal ion issue is a concern, but at the present state of our knowledge, we don't know how big an issue it is. I also advise patients that thus far we've only had 13-year follow-up results for metal-on-metal resurfacing, and that there are no 20 and 30 and 40-year follow-ups. So we don't know what the 20, 30, 40-year implications might be for a metal-on-metal bearing surface.
And would you summarize what you feel the benefits are for hip resurfacing once again?
The benefits are lower dislocation rate, preservation of bone, and I have clearly seen in my patients a higher return to activity levels than with conventional hip replacement. And that most of the younger, athletic, healthy people return to a very, very active lifestyle.
That's good. Well, thank you very much. I know prospective patients will be interested in the interview, and it's a way they can meet you and learn about hip resurfacing too. Thank you
Very much. It's been my pleasure.